especially when it's, the old person that this is kind of a chronic deterioration. I mean, we get so many of these patients. I think that's why it's a huge talking point.
Absolutely.
And it's only going to go up
with that population growth, et cetera, and the aging population. I think this comes down to each hospital medicine group within a range has to sort of self-police or establish its own culture. At what point are we going to say, look, this patient doesn't have a safe option? If that were my grandmother, if that were my grandfather, and the ER had taken the steps that you had and the patient just felt uncomfortable going home, how would I want to see my grandfather treated? Right. And I think that this will ebb and flow, and different groups will have different cultures. I think all our group's culture is probably quite wide in this regard. And we could probably do with a little bit of an internal dialogue about, is this just kind of part of our job and what we do? And we trust our ER providers to have made these offers, to have suggested these things, made overtures to the social work and case manager team. And then the people we're taking is a numerator for us, but it's not the denominator for the whole emergency department.
Mm-hmm. That should be a conversation we should have too. How many of us are actually putting in the extra little bit of footwork on a busy shift for that kind of patient?